Welcome to Rabida Children's Hospital. As you will hear and see over the next few minutes, Rabida is a very special place. Located on the beautiful shores of Lake Michigan, Rabida has offered our young patients and their families the best in pediatric specialty care since 1896. With this rich history of providing care to children and only children, today Rabida is focused on patients who need us most. Kids with chronic illnesses and disabilities, as well as those dependent on medical technology or needing rehabilitation after surgery or an injury. Everything we do is with children in mind. Our holistic, family-centered care goes beyond providing the latest technologies and therapies. It means that we help meet all of the child's needs, body, mind, and spirit. Please take a moment to learn more about our very special place on the lake. Together, we can help each child reach his or her full potential, both inside and outside of the hospital.
Rabida is unique in that we have a wide variety of different kinds of patients that we see, mostly linked by the thread of medical complexity. So these are the kinds of kids that see 4 or 5 different specialists on top of their regular doctors or in the hospital quite a bit. So we see kids who have been premature, who are on ventilators. We see children who have rehab after trauma or burns. We see children with asthma and diabetes and sickle cell who have to be in the hospital a lot. And we see children with very rare genetic congenital kinds of disorders, and we manage their complexities along with the specialists at the referring institution.
Rabida, this is Mary.
Hi, Mary. This is Sheila from the NICU, and I'm calling with a referral for you.
Okay, great. What do you have?
Okay, we have a 6-month-old baby boy, and we think he's ready for transition to Rabida for training and a waiver.
Everybody that is involved in the care of that child speaks together and updates each other. So we're talking speech therapists, physical therapists, psychologists, nursing, respiratory therapists, nutrition, all meet with all of the doctors that are involved.
Ready? Beautiful! You've come such a long way since surgery. One of the most important things that Rabida does for children is that it really gives individualized care based on each child's diagnosis, but also on what their family needs are, what their individual circumstances are. We really try to be sure that we are holistic at Rabida, that we focus on all aspects of a child's care.
The SS Rabida is our child and family-friendly inpatient unit, which is designed like a cruise ship. Everything was planned with the kids in mind: bright colors, a relaxing atmosphere, and first-class facilities. Our young patients are welcomed as VIP passengers and are assigned to a spacious cabin with views of Lake Michigan and Jackson Park Harbor. It's a serene, beautiful setting that we believe helps the healing process.
First time I brought my son here just to visit, we pulled up and he said, "This is not a hospital. It doesn't look like a hospital. It's a beautiful large building on the lake." Everything is about the kids. Every hospital bed has a beautiful view of the lake. When I round here in the mornings, it makes me happy to walk into these rooms, see these beautiful kids, and see this beautiful view. There is not that sterile hospital vibe. We strongly believe that the tranquility that comes from being in beautiful surroundings aids in healing for both children and families.
Our department is called Developmental and Rehabilitative Services, which is a little different to most hospitals just have a rehab department. Our department has a very strong developmental focus. Physical therapists really focus on movement. They are going to help children who have movement problems be able to negotiate their environment. The occupational therapists are looking at visual motor skills, they're looking at hand skills, they're also looking at sensory issues. Infant development specialists focus on children from birth to 3 years of age, and they're looking at their cognition. So what I mean by that is their thinking and their ability to problem solve. And then they are also looking at their social emotional development, how they relate with others in their environment.
Why isn't it going? Okay, press the button.
And the child life specialists offer educational programming to the children because we don't want them to fall further behind while they're here. And they also have play sessions for the children, either at the bedside or in the pavilion.
Hello, Petra. Hello, Petra.
Speech-language pathologists focus on communication, so understanding language and being able to express themselves. And then also a lot of the children that we get referred to our hospital have feeding difficulties. So the speech-language pathologist is the person who is going to make an assessment and address those issues.
So every patient that's admitted to La Rabida receives an individual nutrition assessment, and we follow that with a specialized diet for every child based on their age and their medical condition. And we monitor the child's diet and make sure that they are thriving and gaining weight appropriately so that they can grow and develop to their best potential.
The clinical staff members offer families comprehensive, compassionate, and therapeutic care. We encourage families to participate in their child's care whenever possible. The family's involvement eases the away-from-home stresses a child feels while in the hospital and helps prepare the child and family for discharge. One way we demonstrate our commitment to family-centered care is to encourage a family member to stay with the child. We have pull-out beds in every room, showers, meal vouchers, laundry facilities, free parking, and shuttles, all to help the family spend more time with their child.
Being a parent myself, I know it is very worrying, the thought of you already have a sick child that you're concerned about and taking a transition to another hospital. We are really child and infant friendly here and family friendly, and we want to include you as much as possible in the care. In fact, we want you here as much as you can possibly be here.
They often know their children the best because these kids have been home with perhaps home nursing and not, and they can really help us as to if a child is just upset because they didn't like what they had to eat or if they are actually getting sick today. So they really help us with medical management, and we really do listen to them.
You know, a lot of the staff ask me when they have new mothers coming in here, it's very traumatic to have to mother or nurture your child in the hospital. You know, it's always easier or better to talk to another parent who's actually going through the same thing that you're going. And we could be a little bit more supportive to each other than maybe someone who has never had a serious ill child.
We take care of kids with wide ranges of disabilities and wide ranges of functions. And one of the things that have totally impressed me about the nurses here is they take really exquisite and sensitive care of children who can be very low functioning otherwise. They bond with a child who may be very low functioning in communication.
Hi, how are you? Okay,
good. Yourself?
Good. Hey, Mr. Jaden. So I just came this afternoon to talk to you a little bit about what to expect when you go home, okay?
Case managers provide age-appropriate education to help children and their families understand the child's condition and treatment plan.
Hello everyone, so we're all here for the discharge staffing.
Once the child is well enough to go home, she or he may be seen by an outpatient team of specialists representing all the medical, educational, rehabilitative, and psychological aspects of care.
We have actually ordered a bath chair for you guys to use, and that will be delivered to your house.
So put that in there.
When you leave here, we want you to feel really comfortable and really competent that we have given you all the knowledge and the skills that you need to be able to take your child to the next level.
Get out the toilet. Right, handsome boy? Yes.
My mommy wants him home.